The Cannabis Conversation. A European perspective on the emerging legal cannabis industry.
Welcome to the Cannabis Conversation with Anuj Desai, where we explore the new legal cannabis industry by speaking to the professionals that are helping to shape it. I'm really excited about this week's show. It's about cannabis and cancer. Okay, I'm very pleased to have Professor Dedi Meiri here today with me. Professor Meiri is the Associate Professor at the Faculty of Biology at the Technion, which is the Israel Institute of Technology. He heads up the Laboratory of Cancer Biology and Cannabinoid Research, which is one of the world's largest cannabinoid research labs. It's fair to say that he's one of the world's leading authorities on cannabis as a treatment for cancer, so the perfect guest to help us understand a bit more about that. Welcome, Dedi.
Hi, thank you for having me.
Absolute pleasure, absolute pleasure. I had the really great fortune of seeing you talk at the Royal College of Surgeons in London earlier this year, so I'm really pleased that I'm able to get you on the show. I guess we'll probably start with maybe a bit of your backstory. Did you start out studying cannabis, or how did you move into studying cannabis?
No, my laboratory for cancer research, and actually cannabis came from the back door. In my background, I have a master's in biochemistry and a PhD in molecular and genetic plant biology. And then I moved to do a cancer research where I did my postdoc in Toronto. I did a cancer research. When I came back to Israel and got my own lab, I tried to combine my knowledge in biochemistry, plant biology, and cancer. Mm-hmm. And something like 4 years ago, I saw a publication by a Japanese group that showed that if you put cannabis on breast cancer, it's blocking their ability to migrate. And this was exactly the focus of my lab. How cells that usually don't have ability to move, like skin cells, liver cells, breast cells, when they become cancerous, they have the ability to migrate and to do invasion and create metastasis. So see this publication fit to me exactly. I said, oh, okay, this is biochemistry, this is plant biology, and this is cancer. Then we started to work with the anti-cancer properties of cannabis. From there on, we hit walls all the time where there was no knowledge 4 years ago about the active compounds in the plant, about the endocannabinoid system in our body. And in every time that we faced a wall, we had to break this wall and to go forward. And we actually create system and methods to do our research. And this method lead us to be in a place that we are having abilities that other laboratories in the world don't have, which opened the gate for a lot of collaboration and a lot of other types of research among cannabis, medical cannabis in general. So today my lab is still anti-cancer properties of cannabis is a major, but we are also doing research around neurobiology, which we have epilepsy, Alzheimer, sleep disorders, multiple sclerosis. We are doing research around the immune system, how cannabis affects the immune system. We're participating in 13 different clinical trials. We're creating database of patients in Israel. We're doing large variety of types of research around medical cannabis.
Fantastic. That sounds such an amazing project, and I'm sure lots of people are very hopeful of positive outcome to your research. Well, one of the things that you mentioned at the talk at the Royal College was you started off by saying that cancer is a collection of diseases. Which particular types of cancer are you focusing on, or that are showing the most sort of promise that cannabis is having an effect on?
Yes, so one of the major problems that we faced in the beginning was we read a few articles by Manuel Guzman and Christine Sanchez from Spain, and then the Japanese group and other groups that showed that cannabis can affect cancer cells. But we ask ourselves, which types of cancer, since cancer, it's a given name to hundreds of different diseases, not thousands, but hundreds of different diseases. And cannabis is a given name to hundreds of different species. Just in my lab today, I have over than 800 different types of cannabis.
Wow.
Cannabis is a unique plant because it creates unique compounds called cannabinoids. But there is no just one cannabinoid, so two. Today, my lab have the ability to identify and isolate 144 different cannabinoids. In the plant, we call them phytocannabinoids. Phyto because it's coming from the plant.
Wow.
So the question, which combination of phytocannabinoids affecting which type of cancer, it's the major question we're asking in the lab. We're working on, I would say, something like 15 different types of cancers, which in part of them we see very promising effects. Our goal is to try to understand which type of cannabis, which combination of compounds affect which types of cancer and what is the mechanism that's causing them. So why these three compounds affect just breast cancer with this specific mutation? And the major cancers that we're working on are leukemia, breast cancer, and colon cancer. I think these are the three major, but we're working on also glioblastoma and other types of cancer.
And yeah, if I can delve a bit deeper on that, what made you choose those particular types to study on? Because obviously, as you said, there's hundreds of different types. What led you to sort of focus on the 15 that you are currently?
So usually we're doing what we call high throughput screening. We started with a large screen. We're taking one type of cancer and screen hundreds of different types of cannabis. When we find something unique, when we find a specific type of cannabis affecting specific types of cancer, then we are going deeper. Then I will take a PhD student or postdoc and we'll put him on this project. So usually we are starting with a large screen and then going deeper. In most of the cases, we started with a screen. In few types of cases, we first identified on the patient that getting cannabis an effect and then took it to the lab. So today in Israel, we have 49,000 patients that getting cannabis under physician prescription. Around 20,000 of them are cancer patients. The cancer patient in Israel getting cannabis not to treat the cancer, but to be able to deal with the treatment usually. So cancer patients with getting radiation or chemotherapy suffer from nausea, from pain, from sleep disorder, from mood, and cannabis affecting all of them. Cannabis increase appetite, reducing nausea, reducing pain, improve your mood, and you're actually getting something like kind of a holistic treatment. Instead of taking 5 or 6 different pills, you're getting cannabis will help you to deal with the situation of the treatment. So in Israel, we have almost 20,000 patients that getting cannabis for the palliative care, for the treatment of not the disease itself, but the symptoms. But from these patients, sometimes we identify patients that the cannabis also treats the disease itself. And from that samples, we're taking it back to the lab and trying to understand, first of all, if it's real, which type of cancer, which type of compounds, and how, and what is the mechanism of action and why it's causing.
That's very interesting. Yeah. So you kind of start off with anti-side effect measures, and then you realize that it was also having an effect on reducing the amount of cancer cells that are in the body, was the evolution of that. That's really interesting. And you meant... Sorry, carry on.
Yes, but I want to be very, very accurate and specific.
Yeah, of course.
I don't want the audience to think that now today they can take cannabis as a treatment for their cancer. It's very dangerous because we need to understand that it's still a lottery. We have hundreds of different types of cancers and hundreds of different types of cannabis. And cannabis won't solve all the cancer problems in the world. If you ask my opinion, I believe that in 3, 4, 5 years, there will be specific types of cancers, that there will be specific types of cannabis that will be a treatment for them, but it will be very, very specific. It's not all types of cancers, and it's not all types of cannabis. And today, for a patient to know to choose which cannabis he needs to take in order to treat his disease, it's still a lottery, and still the percentage of success is so low that it's not replacing any conventional treatment. That's
really good to make that note of caution, because I guess with cancer, much like most sort of very grave diseases, people have a lot of hope, and they probably want to hear very positive news, but it's good to hear what the reality is. But hopefully your research is going to help us to sort of narrow down where it does work for sure. You mentioned palliative care as well. Does your work cover any of that, sort of making people's end of life more bearable?
Sure. So part of our work in the lab, since we are one of the only labs in the world that are able to identify all the active compounds of the plant, we're talking about around 140 phytocannabinoids, 120 terpenes, 50 flavonoids. So we actually realized that we have a huge clinical trial that's running outside. We have more than 40,000 patients that are getting cannabis. And we're the only one that can identify what exactly they're getting, not just calling them white widow or purple haze, to know exactly what they're getting. So we started to do a database, which in Israel in the last 3 years, every patient, every cannabis that's going out to a patient is going through our lab, and we're doing full identification. We know exactly, we have a fingerprint for every cannabis, every material that the patient can get. On the other hand, we collect data from the patient. The patient is filling questionnaires every month, and we are trying to merge these two arms. Mm-hmm. On that times, we're doing a lot of types of research, which is on the side of the palliative care, to see how cannabis can improve quality of life of the patient. Mm-hmm. And I think one of the major things that cannabis is doing is improving quality of life. I will give you one example, not from cancer, but from pain patient. We did a study with Professor Elon Eisenberg from Rambam Hospital on 2,000 pain patients. So we started to follow up the patient from the moment the physician decide to give them cannabis prescription. And we started to follow up and to see how it's affect their pain, but also how it's affect other parameters. And we follow up on these patients for 2 years. And when we look on just on the pain, it was a little bit disappointing because there was 45% success in this patient, that it reduced the pain, but it's not reduced the pain in a very severe type like, let's say, opioid will do, okay? So the patient mark, my pain is 8, 9, 7, and we see that cannabis reducing something like 2 points, which is not the best treatment for pain. So actually, if you look just on these parameters, it's a little bit disappointing. But when we look on quality of life, when the patient measured his quality of life, so in the beginning, most of these patients have very low quality of life. We are talking on very severe pain patients that tried at least 1 year of other treatment before they got cannabis. So we are talking about chronic pain patient with a severe pain. All these 2,000. So if you look on the quality of life, it was very low. But if we look on the quality of life of these patients, in the end of the research, it jumped to be quite high. Right. Which was surprising. If you don't reduce the pain so much, why this patient saying that the quality of life is high? And then when we look inside and we look on all the questionnaire, we saw that the cannabis a little bit reduced the pain, a little bit improved the sleep, a little bit improved the mood, a little bit increased the appetite. And in total, you have a major improvement. So if you're taking a patient 28 years old, this is a specific case that I know. You're taking a patient 28 years old that's severe from neuropathic pain, very severe pain. He's living with his parents, he's not working, he's under depression, okay? Then he started to take cannabis. It's a little bit improve his pain, a little bit improve his sleep, a little bit improve his mood. He's starting to work, he have more money, he's starting to go out with his friends. He met a girl in the pub, he moved to live with her, and now he's before getting married. So from a patient that was depression, living with his parents, sleeping all day, to a patient that's working full-time job, or about to get married, this is huge improvement in quality of life.
Massive.
I will give you one details. In the beginning of the research, 25% of the patients work full-time job. In the end of this trial, 41% work full-time job. So 60% more of the people working full-time job. 15% work partial-time job. 35 work partial-time job in the end. So majority, big part of the patient starting to work. So these small details doing huge improvement. And this is something that we're getting from cannabis, which is a treatment that affects a lot of things in our body and improve a lot of small things, minor things that in the total are major.
Yeah, I mean, that's fascinating, the cumulative effect. And it's a different way of looking at it, I suppose, rather than just an isolated factor that you're seeking to sort of improve. I mean, we could talk about that for a lot longer, but if we could just go back to cancer in terms of the specifics. I mean, again, the audience is not necessarily very scientific, but at a high level, I was reading that the cannabis, or the promising signs of cannabis in relation to certain cancers, is that it, as you describe it, it helps bring back the ability of cancer cells to commit suicide. Are you able to explain that a bit on a high level for us?
Yes. Cells in our body have machinery called apoptosis, which they can commit suicide. A cell in our body, every cell is the basic unit for life. If you're taking cells out of our body and put in the plate, it can live, it can be independent. And actually, if you look on the nature, there are creatures which are one cell, like yeast or bacteria. So cell is the basic unit for life. But cells are usually working organs, and they can communicate with the other cells. And the cells have something called checkpoints, which they check themselves all the time if everything is okay. And if the cells realize that there are more major problems in his activity, usually he will commit suicide. In every moment in our body, there are thousands of cells that are committing suicide. This is the basic mechanism in our cells. Cancer, as we said in the beginning, are a given name to hundreds of different diseases. But we put them in a box. We call it the 6 hallmarks. We said every time that we see A, B, C, D, E, F, we will call it cancer. The first thing in these hallmarks, the cells learn how to avoid this machinery of apoptosis, of committing suicide, or they have kind of a defect that they can't commit suicide. So even they are getting more mutation, more defect, and more problem, they are staying and not committing suicide. Because think about it, if the cells still have the machinery of apoptosis, so if there will be kind of a problem, they'll just disappear, they will commit suicide, and other cells will take their place. But if they can't commit suicide, then they become dangerous, because by time they will create more and more and more mutation, more and more defect, until they will become an aggressive cancer cell. What we see with cannabis, and this is again work by Manuel Guzman, Christine Sanchez, and other scientists way before me, they show that if you put cannabis on these cells, it's bring back the ability of these cells to commit suicide. We don't know the mechanism to the end, but it's not far from what we're doing with chemotherapy. We're actually moving the red line for the cells. If the cell said, okay, this is not enough for me to commit suicide, a lot of the chemotherapies, what they are doing, they're moving the red line, said, now you need to commit suicide. Usually chemotherapy are affecting every dividing cell. What we have, the checkpoints are major in cells that divide. So we're stacking the division of the cells, and this is moving the red line. Cells said we're committing suicide. Because cancer cells are dividing much faster than regular cells, they will be the first one that will get hit by chemotherapy. But other cells that dividing fast, like hair cells, like colon cells, will be affected by chemotherapy also. This is the reason we are losing hair, we are vomiting, because other cells being affected.
Right.
What we see with cannabis, that usually it's hitting just the cancer cells and not the other cells. It's still not clear why. It's still not clear what is the mechanism. It's still not clear which types of cannabis on which types of cancer.
Right, really interesting. So it's almost like a targeting of the cancer cells rather than the sort of scattergun approach of chemotherapy.
Right.
And to extend on that, then you mentioned strains of cannabis. So this seems to be quite an important factor then in terms of, given that there's, I mean, what did you say, 140 cannabinoids, 120 terpenes, and it's over 300 different compounds in the plant, and the various combinations of that, and then the various hundreds of different diseases. That's going to take quite a long time to research, I assume.
Sure. If somebody thinks that we will solve the problem of cancer in 2 years by cannabis, it's totally wrong. This is years of research. I don't know how to do shortcuts.
No.
Just to create a tumor in mice take a few months. This is research that's taking very long time. In the field of cannabis, somehow people losing the sense of time and logic and reality. People are coming into my lab and said, I'm a grower and I can grow plants and that. You will tell me what is solving the Alzheimer problem and I will grow this plant. And I'm looking at this guy and I said, are you real? I don't know how to solve the problem of Alzheimer. I said, yeah, but you're doing cannabis research with that. So let's say in a year you will know and I will grow. What do you think that I will solve the problem for Alzheimer in the world in a year? It's not working that way. If until the end of my life I will solve one kind of problem, this I did my sharing in the world. It's far, it's a long time, it's a lot of money. It's not something that we will have a solution in few months or in few years. It's a lot of work.
Yeah.
This is my occupation. This is what we're doing, but nothing takes from today to tomorrow.
Yeah, no, of course. And we're starting late as well. We've only in the last few years been able to start studying it, so it's a long journey. I mean, would your approach to it be that you look for a certain combination of cannabinoids that work on you take a particular type of cancer and then you test different combinations of cannabinoids and see which gets the better results? Is that one of the methodologies?
Yeah, well, the major methodology that we're doing in the lab, we're starting with the whole plant, whole extract, like full spectrum.
Yeah.
And when we see a strong effect, when we see something that's unique, we're starting to narrow it down. We're doing fraction. Let's say we have 300 compounds now inside the walk. So we divided them to 50, 50, 50, 50, 50, going back to the mice or to the cells, see which part is doing the effect or which combination of parts is doing the effect. And then we narrow it down until we're reaching single compounds or single combination. Usually what I see today, it's ended with 3, 5, 7, 4. These are the numbers in the end. So it's not the whole plant and it's not a single one. It's a combination of few that affecting the cells. And I understand the logic behind it. Again, I don't want to go to the scientific details, but in our body, we have endocannabinoid system. We have actually our body produce these compounds.
Wow.
And the endocannabinoid system, it's a regulation system. It's a homeostatic system. It's a system that's balancing many effects in our body, how we feel appetite, how we feel pain, how we feel joy, immune system, all of this being balanced by the endocannabinoid system. The endocannabinoid system have two parts. There is the ligand, there is the message that one cell sending to another. On the other side, there is the receptors, the protein that can catch this message and read it. So on every type of cell in our body, there are endocannabinoid receptors. There are the proteins that can read the message. What cannabis is doing is mimic what our body is doing. You have the same compounds in the plant or similar compound that can actually deliver a message to the cell. But on a single cell, there are few different proteins that can read different messages. So it's a combination between the compounds in the plant that you have, the combination of compounds, and the combination on the specific cells that can read it.
Right.
So it's a very complicated system, how the cannabis affecting our plant, our body, and this is the research that we're trying to do and to understand.
Yeah, the amount of combination of variables is mind-boggling. So I can imagine how big a task this must be. Would you be looking to maybe synthesize the certain cannabinoids that show the most promise, or are you kind of looking at whole plant solutions or a mix?
I don't have a good answer for that, and I'm a scientist. I don't have emotional feelings to the plant. In the end, if there is a child with leukemia, I wanted this child to live, and I want him to survive, and I want the treatment to be the best for this child. And if in the end it will be whole plant, it should be the whole plant. If in the end it will be single molecules or few molecules synthesized, so that's what it should be. In the end, I want in this world to help people that suffer, and I don't really have opinion how the way to reach this goal should be. In general, in cannabis, and we spoke a little bit about it before, I believe that there are two arms. There is one arm which is the whole plant complicate more on improving quality of life. If you're taking PTSD patient, post-trauma disorder patient, which suffer from nightmares, and they have a problem to sleep, and you have anxiety, and you have other symptoms, cannabis can affect a variety of these symptoms. It can help falling asleep. It can eliminate the dreams. That's part of what cannabis is doing. It's affecting short memory. It can reduce anxiety and improve the mood. So on all of that, I don't believe that we will succeed to decrease it to specific compounds. It will stay as the whole plant treat. On the other side, when we want to treat a specific illness, whether it's reducing seizures in epilepsy or cancer cells or something that is very, very specific, a point that we can put our fingers and this is what we need to change in order to have a huge improvement in the patient, it might be that on these type of illnesses, we will define specific molecules, one of few, that will be giving as a regular medicine, in the pharmacy, maybe synthetic or from the plant, it doesn't matter. And it will give by prescription, very accurate, milligram per gram, and so on and so on.
Yeah.
So I think in the future, there will be two arms of the medical cannabis field.
Yeah, I mean, that makes complete sense. People feel very strongly about the whole plant, but I think as you make the sort of distinction between, there's different types of things that you need to target, I suppose. And what about sort of, is it too early to say what sort of level of dosage might be that this works on? Will people have to take quite a lot of it, or are we not there yet?
First of all, there is almost no toxicity in cannabis. So people are saying it wrong, that they are saying that there is no side effect. All this plant is one big side effect, in changing your sleep, changing your appetite, changing your mood. It's all side effects. Depends what you want to treat.
Yeah.
But there is no toxicity, so there is no overdose. You can take high amounts of cannabis. You will be total stoned for 5-6 hours. You will be total out. But then you will get up and everything will be normal. There is no toxicity, whether in almost every other medicine that I'm familiar, if you take overdose, you can die. So first of all, in general, you can take high dose without affecting. And now we need to ask ourselves which type of disease you want to treat, and the dose are highly changed. There is a big change between reducing pain or reducing seizures in epilepsy, or reducing or increase appetite or killing cancer. This is a variety dosage of cannabis on these different types of illnesses that you want to treat. There are part of illnesses that you need very, very, very little amount, and there are different diseases that you need high amounts. And in both of them, it's really depend on the illness that you want to treat.
Yeah. I mean, that makes complete sense. So I think we're coming towards the end, but you mentioned we need to be a bit more realistic about this in terms of cannabis research. Are there any other areas that we should be cautious and not get too overexcited about?
So I think, people said about cannabis that it's a bubble and it's a hype. And in part of that, I agree. But I think it's a bubble and hype as computer and internet were 20 years ago. Mm-hmm. So, there was tons of companies that did the computer science, and 90% of them closed and didn't reach anything. But we can't say that the computers and internet are not a major things in our life. Mm. I see cannabis treatment quite the same. There is a hype, and people say about cannabis that it's doing everything, and it's probably not. And I think there is tons of companies and people that are riding this hype to make money. But in the bottom line, there is something very real here. We have endocannabinoid system that's controlling almost every system in our body, and cannabis affecting this system. And for that reason, there is a real effect on our body and a real medicinal effect if we can learn it and point it. I think there are few illnesses that the placebo, the point that people believe it's going to help, sure, is the effect and not the real effect. And I think there are few areas that still not being treated by cannabis that cannabis can help. So I think there is two sides of these coins. I think there will be few illnesses or treatment that will be disappear because we will learn that they are not real and cannabis can't help on that. Yeah. But on the other hand, I think there will be few treatment that will arrive and we will learn that it can help on that. Yeah. I think everything related to Alzheimer and dementia, we will learn that cannabis can affect it strongly. And on that side, I think, again, we'll need to learn which strain is helping and not hurting. But I think, and our results and other group in the world that are doing that have very strong evidence that cannabis can affect dementia and Alzheimer. And there are other illnesses like that or diseases like that I think cannabis will help.
Yeah, and I'm sure people will be very keen to hear that. And also probably pain is the one that always comes up whenever I'm talking about medical cannabis. And you talked about that at the beginning. So hopefully there's some breakthroughs there as well. I'll go on to my usual last question. It might not apply so much to you given what you do, but my usual last question is, what did your family or your parents say when you told them you were moving into cannabis? But if that's not the right question, have you had to overcome any stigma when you started studying this plant?
So I started 4 years ago, and I was kind of pioneer in Israel, even though, in Israel we have Rafi Meshulam, who is the godfather of this field, and he was a very important professor who will be 90 this year. But he's still running and giving talks. And when I was a student, we all knew who is Rafi Meshulam. We know his research. The stigma in Israel was in the beginning, but mainly by my colleagues at work, that didn't see it as a good idea for me to work with cannabis because it's not serious and to work with drugs. Outside of the university, I didn't have any kind of reaction, and I did cancer research. It doesn't matter which material you put on the cancer. I consider myself still as a head of a laboratory for cancer research. And for that, I think my family and my parents and my friends are quite proud.
Of course.
I didn't see or I didn't have any problems or any kind of stigmas when I started to work with cannabis. I had a little bit, comments from my colleagues in the university. I was a very young scientist. I just got my own lab. I just started. And people that recruit me here thought that it's not a good idea to start work with cannabis. There is something called academic freedom. So nobody is really involved or will tell you what to do. They just told me their opinion. But otherwise, I didn't have any problem.
Well, we're very glad you didn't listen to those people, but also very glad that you've received such great support from your family and friends. Cool. Okay. Well, that wraps it up, actually. This has been a brilliant conversation. I've been really looking forward to speaking to you. So I'm certain that my listeners will also really benefit from all the wonderful information you've given us.
Okay. Thank you very much.
No problems. Yes, thank you, Dedi, and I hope you keep well.
Okay.
Take
Bye-bye.
care. Wow, what a great interview that was. Thank you for joining me for that. I hope you enjoyed it. A real honor to have Dedi on the show. He's doing such amazing and fascinating work, but I think it was pretty clear just how big a task he and his team, and in fact all researchers, have ahead of them. So many variables, so much to explore. It's going to take a little time, but it's obviously really encouraging signs for the future, and hopefully it will lead to some cures, if not just a better quality of life for people suffering. I'm on the lookout for some more guests, and in fact I'd quite like to speak to any MPs or prominent police people who have a view on cannabis. So if you know any of those, please get in touch. As always, please like and subscribe and share. It's really helpful to me. Cool. Okay, well, have a great week, and I'll catch you in the next one.